Good morning, everyone. Today we'll explore marketing communication for reproductive health SRH products. Essentially, we're looking at how healthcare providers, organizations, and marketers deliver the right messages to the right people to improve health outcomes. Effective communication doesn't just inform people about services like contraceptives, STI testing, or prenatal care. It also builds trust so that individuals feel confident to use these services. Before we discuss strategies and tools, it's important to understand the environment in which SRH marketing operates today, because the way people access healthcare is changing rapidly. The SRH market has evolved significantly over the past decade, largely due to digital technologies and changing patient expectations. Digital and technological shifts, patients now expect fast, discreet, and convenient access. For example, smartphone apps now allow anonymous consultations for contraception or STI testing. Adapting marketing strategies. Traditional posters or radio announcements are no longer sufficient. Modern campaigns must leverage platforms like Instagram, WhatsApp, and health apps. Dynamic channels preferred. Services such as online booking, home delivery of contraceptives, or virtual consultations are increasingly demanded, especially by youth and urban populations. These changes mean that modern SRH marketing must meet higher expectations for convenience, discretion, and credibility. Let's explore what that entails. Today, SRH marketing is not just about spreading information, it's about building credibility and trust. Credibility and ethics. Messages must be accurate, culturally sensitive, and trustworthy. Misleading claims or insensitivity can damage community trust. Digital savvy audiences. Many people access SRH services via smartphones, so content must be designed for social media, health apps, and online platforms. Countering myths. Effective campaigns tackle common misconceptions, such as fears about contraceptive side effects or misunderstandings about fertility treatments. To ensure these messages are received effectively, we need to understand the communication process itself. Communication in SRH follows a structured process to ensure messages are received and understood. Source could be a healthcare provider, NGO, or social influencer. Credibility is key. Audiences need to trust the messenger. Encoding. Information must be clear and engaging, whether through videos, infographics, or written content. Medium. Channels include social media, clinics, SMS, or community meetings. Choosing the right channel is crucial for accessibility. Decoding. Patients interpret messages through their own beliefs, literacy levels, and experiences. Barriers. Stigma, misinformation, or low literacy can prevent messages from being understood correctly. Understanding the process helps us identify the conditions that make communication effective. Certain conditions must be met to ensure SRH messages reach the right people and have an impact. Understanding diverse audiences. Adolescents, married couples, and rural women have different concerns and information needs. Privacy-friendly channels. For sensitive topics like contraception, confidentiality is crucial. Feedback and monitoring. Observing responses and engagement allows messages to be refined for clarity and effectiveness. Addressing misinformation. Repeated and clear communication helps dispel myths about contraceptives, STI testing, or fertility treatments. Now let's look at the tools used by marketers, the communication mix, and how each plays a role in SRH. The communication mix is the combination of methods used to deliver messages effectively and reach the intended audience. Advertising, posters, radio, TV, and social media campaigns. Example, Instagram videos demonstrating correct condom use. Personal selling, face-to-face counseling by healthcare workers or pharmacists. Public relations, community outreach, health events, and collaborations with local leaders. Sales promotions, free samples, discounts, or incentives to encourage uptake. Direct and digital marketing, SMS reminders, telemedicine apps, and emails.
Let's examine each of these channels in more detail, starting with advertising. Advertising raises awareness and educates communities about reproductive health. Digital platforms, Instagram, TikTok, and WhatsApp are effective for engaging youth. Ethical and culturally sensitive messaging. Avoid shock tactics or inappropriate content. Privacy-focused design. Ads should convey information discreetly, e.g. anonymous hotlines or discreet packaging. While advertising reaches many people at once, personal selling allows for one-on-one guidance. Personal selling involves direct, face-to-face communication, usually delivered by clinicians, midwives, or pharmacists. Builds trust. Patients can ask questions and receive individualized guidance. Tailored ICE. For example, explaining IUD insertion or managing contraceptive side effects. Ethical approach. Staff must remain neutral and respect patient autonomy. In contrast, public relations focuses on engaging entire communities rather than individuals. Public relations strengthens trust and awareness through community-level engagement. Community engagement, using local leaders, events, and campaigns to educate the public. Education and outreach. Example, organizing a reproductive health day at a village center. Higher credibility. Face-to-face interaction and local validation make PR more trusted than advertising. Sales promotions also encourage immediate uptake of SRH services. Sales promotions motivate people to act promptly while providing educational value. Free distributions or samples, example, providing free condoms at events. Discounts and incentives, reduced fees for STI screenings during health campaigns. Ethical practice, promotions must educate and not mislead. Digital marketing has become increasingly important, particularly for privacy and wide reach. Digital marketing allows information to reach audiences widely, quickly, and discreetly. Anonymity and broad reach, patients can access information without stigma. Platforms, social media, telemedicine apps, and SMS. Reduces stigma. People feel comfortable seeking services online, which can increase uptake. Regardless of the method, ethical principles guide all SRH communication. Ethical communication is the cornerstone of SRH marketing. Transparency. Always provide accurate, evidence-based information. Respect autonomy. Patients must make informed choices without pressure. Privacy. Protect sensitive information and identities. Cultural sensitivity. Respect local beliefs and norms to ensure acceptance. Combining all these tools strategically increases impact, which brings us to integration. Integration ensures that all communication efforts work together seamlessly. PR plus digital. Combine events with online campaigns for reinforcement. Personal selling plus digital. Counselors can follow up via SMS or apps. Advertising plus education. Normalize SRH topics while reducing stigma. Ethical promotions. Widen access while maintaining trust and credibility. Finally, let's summarize the key points from today's lecture. In summary, effective SRH marketing communication requires cultural awareness, tailor messages to resonate with diverse audiences. Ethics and privacy. Protect patients' rights and confidential information. Digital integration. Online channels enhance reach and discretion. Long-term trust. Focus on building understanding and confidence, not just immediate uptake. Remember, our ultimate goal is to make reproductive health services accessible, acceptable, and correctly used by those who need them most.